Hey, welcome to Be Still with Dr. Anita. I am Dr. Anita Marcazzani. I am a licensed psychologist. This is where I help you pursue your emotional healing by giving you the best of psychology and fusing it with the truth of the healing power of Jesus Christ. And I'm so glad that you're here. This is my very first podcast, and I'm excited to get this started. I wanted to welcome you to this broadcast. I want to be able to give you information, education, and support as you are on your journey towards facilitating deeper levels of emotional healing. I'm also the author of this book called Be Still, which is the same name as this program here. And I conduct retreats and conferences all around this idea of fusing psychology with the healing power of Jesus Christ. And it's been a very exciting journey for me, and this is the next step. So I'm glad that you're here to watch. This is to make my attorneys happy, just for information, educational purposes only. This is not meant to replace therapy. It cannot be therapy. I am not interacting with you personally, so I don't know your situation. So I'm not here to give you direct, specific psychological advice, but rather just to frame some topics from the Christian worldview that are going to be relevant possibly to your journey of healing. And I want to start this episode with tackling a very difficult topic, and that is the idea that our current mental health approach is failing. And I say this with a grieving heart, but we need to be upfront about what is going on by looking at the numbers and being honest about what happens when we strip sound theology out of mental health. So, what this means is that prior to COVID, our modern society here in the United States was on a very negative trajectory when it comes to mental health. We were struggling. In many ways, we were limping emotionally into COVID. And then since COVID, things have exploded in a very negative direction. And part of it, the problem with COVID and the crisis that the mental health field is in right now, because we cannot possibly meet the growing demand for mental health services the way things are set up right now. We kind of created this problem by not getting a really good grip on treating mental health before this crisis happened. And I say that because when you look at the numbers of mental health problems in the United States compared to the amount of mental health information that we have now, something doesn't make sense. Suicide is on the rise. It's actually on the march, is the way that I talk about it. Even before COVID, suicide was actually increasing at a rate that it became one of the top 10 causes of death in the United States. It had been number 11 and it moved up to 10. This is a bad situation. There are certain aspects of our demographics that are growing exponentially with their rate of suicide, in particular, children. And I'm talking about children ages 8 to 12 who are presenting more and more frequently to emergency rooms because they have suicidal thoughts and suicidal intent as young as 8 years old. And something is very wrong. Okay. Do you understand? The rate of depression is skyrocketing. Over the early 2000s, the rate of depression actually increased by about 20%. That outpaces population growth. So it isn't about population. And I don't necessarily think that it's about improved diagnostic skills, although they may account for a portion of it. I don't want to diminish that and how important that is. But that doesn't explain that kind of a rate of growth. In terms of anxiety, every year, 40 million American adults have a diagnosable anxiety disorder. At the same time, we currently have more mental health providers than we ever have before in history. There's substance abuse counselors, there's mental health counselors, there's psychologists, there's psychiatrists, there's social workers, there's family and children counselors. You name it. There are so many categories of mental health providers that universities and colleges are pumping out and states are licensing. So these are licensed mental health providers So many who are being trained to address mental health problems, more than we've ever had before. We know more about mental health issues than we ever have before. We have decades and decades of research that help us understand why depression happens, why anxiety happens, what are the correlates of schizophrenia and bipolar disorder and obsessive compulsive disorder. What are therapies that we can use to try to improve the symptomatology of all of these mental health problems? We know more now than we ever have before, and yet we are sicker, have far more emotional disease than we ever have before. Something doesn't make sense. It just doesn't make sense. Now, I hesitate to argue that it's because we have improved diagnostic capabilities and that we're more able to fine tune the diagnosis of conditions that have actually been around all the time and we just didn't really recognize them or were able to diagnose them properly. I don't want to dismiss that argument totally because I believe that that is true for some things. For other things, not so much. Not so much. Here's the problem. Psychology, mental health, the entire industry is 100% secular, or at least they tell you that they're secular. What that means is they don't necessarily advocate for Christianity or Islam or Judaism or Hinduism or anything like that. They say they don't take a stand in any particular spiritual tradition in that way of organized religion. And so I start this podcast journey, understanding that uh, therapists are in a very difficult position if you're Christian in particular, because we have to, as a professional, understand that someone coming into our office is not coming in for spiritual guidance. They're not. They're coming in because they have emotional issues. And our ethical standards require that we address only those emotional issues, that we not introduce anything spiritual into the conversation, into the therapeutic relationship, unless the client does first, in which case that opens the door. However, because psychology is technically secular, although I'm going to tell you in a second, it's not realistically secular at all, as a field, they don't really take a stand. And I don't, this is when you're just a therapist and you're just doing stuff that you do on a day-to-day basis and you're in your office, anybody coming in, you're going to treat people who are Muslim, you're going to treat people who are agnostic or who are atheists, you're going to treat the whole spectrum of people from a spiritual standpoint. And that's not your job to, promote one particular spiritual tradition over another. It really isn't your job. What I'm here to argue, though, is the difficult truth that we need to face, that maybe that's not the best way to go about treating mental health problems. Because when we have stripped Christ from mental health and we say that they don't have anything to do with each other, we put ourselves in a box. And is it possible that because we have insisted that mental health treatment be stripped of organized spirituality traditions, that we're actually setting people up to have worse problems? So I alluded a few minutes ago to the reality that mental health is technically secular. And that's the truth. I mean, when you go to a therapist, it doesn't matter what religion or non-religion you come in with, that therapist is going to respect you. They're going to respect that you have religious beliefs or not. So whatever you come in with, it's not like a therapist is going to sit there thinking, oh, and judge you. Oh, you're really screwed up because you don't believe in Jesus, or oh, you're going to hell because Allah says so. That's not what your therapist is thinking. They're going to respect you. They really care about you and what you're going through, and they just want you to feel better. And that's true. It's also true that the mental health industry has full on embraced Eastern spirituality. Now, I would imagine that from a mental health standpoint, it's easier for them to promote Buddhism, for instance, because Buddhism is not really organized. It's not a technical religion because Buddhism doesn't recognize a higher power that is a beneficent, deity like God, Yahweh, who exists over and above outside of everything. Buddhism is kind of a weird anti-religion religion. It is a spiritual tradition, and it believes in that there's something beyond us, but that the things beyond us are created by humanity itself. So I say all of this because mental health professionals are regularly trained in techniques that stem from Buddhism. So meditation, transcendental meditation, all kinds of mindfulness that leads to meditation in particular. I just the other day got another advertisement to come to a training on learning about meditation and how science has shown that it really improves a lot of symptomatology in mental health problems. And it does. That science does show that. There's no argument for me about that. That is what the research shows for sure. The problem is that what the mental health field doesn't appreciate necessarily, and what the science will never show because it can't, is that when you engage in meditation, it is not a neutral act. Now, mental health practitioners will approach it as if it's neutral, so that when you're meditating and you're emptying your mind and you're just calming yourself down and you're even opening yourself up to the universe or whatever they want to call it, or even if you're not opening yourself up, if you're just focusing on emptying your brain and calming down your mind to a point where there's nothing in your mind, that comes with consequences spiritually. Now, I would argue that those consequences are very dire and very important. The problem is that the mental health aspect of it, because it stems from Buddhism, doesn't believe that. They don't believe that there are evil spiritual entities out there that are really excited to bring you down and to get control of your attention and your worship. They don't believe in any of that. And in fact, they would probably suggest that that's nonsense or fictional. And they're free to believe that. But if it's true that there are evil entities out there that are just waiting for an invitation, then conducting yourself in a manner that invites them in by, for instance, doing Buddhist meditation, guess what's happening? You're introducing opening a door for entities other than perhaps Jesus to come in. And it doesn't matter whether you believe this or not. If there is a supernatural realm, and I certainly believe that there is, then it is established and structured the way that it is established and structured. It doesn't matter if you or I don't believe in it or don't think that it's really the way that it is. It's the way that it is. And we can either accept that and study it and understand it, and then also understand the ramifications of why it's set up the way that it is and what happens because it's set up that way. Or we can just pretend like, no, I'm sure everything's going to be fine. And just because my anxiety reduces when I use these techniques, therefore it is a helpful and healthy technique. And the reality is that when you do use meditation and yoga and all of these Eastern type approaches, they do result in less symptomatology, particularly with anxiety. Can't argue with the outcome. My concern is that perhaps in the trade-off of reducing anxiety and reducing symptomatology, you're introducing a spiritual problem that may take some time to actually take root and grow. And that also by introducing these gateway concepts of meditation and yoga and the Eastern-based techniques and strategies, that it opens the door to pursuing more in a deeper way, understanding more about them. And that always leads you to a path that is more pagan-based and certainly not Christ-based. And this is just how it is. And I just want, we have to start this conversation. I can't tell you that I have a solution for it other than the solution is to make sure that we're grounded in Jesus Christ. But the reality is that if you're a therapist watching this, I know you're going to have clients who are Muslim coming into your office who really need help. And your job isn't to convert them to Jesus. It's not. It's unethical for you to even consider doing that. So I don't know what you do with this situation when you are required to engage in the therapeutic approaches that science has shown reduces these symptoms, because that's what your training has taught you to do. And so that's what you're going to do. But at the same time, it's important to open your mind and your understanding that in doing that, there's this whole other set of consequences that we have now potentially introduced into this person's being, into their spirituality, that may end up doing them more harm. And I have to wonder, because meditation and relaxation techniques have been practiced in mental health capacity certainly since the late 80s, as early as the 70s with transcendental meditation. It wasn't widely used in the 70s in mental health, but that's kind of where it started. And now it's a standard part of teaching of therapy around anxiety in particular. So what do we do? Because it's standard. I don't know what to do is the short answer to you, except to understand at least that there is a problem here. And that as much as mental health seeks to be secular, it's not. If it is embracing any of these Eastern-based rituals, then it is not secular. It's actually taking a religious stand against the more monotheist traditions of Christianity, Judaism, and Islam. Okay. And as a mental health field, we just have to have our eyes open about that. And we need to be honest with ourselves as a profession that that's what we're doing. We're by aligning ourselves as a profession with the Eastern modalities, that's not a neutral stand. It is taking a side. And we can't pretend that it's not anymore, because there's too much going on that doesn't make sense. And it's time to think about the fact that perhaps we are trading symptomatology for spiritual oppression. And it might be worth examining if we should stop that or not. Now, I don't know what your situation is. If you are a consumer of mental health services, if you're a therapist, or if you're just interested in this issue, wherever you are, I want you to start thinking about this. As I said, I don't know that there's an answer other than Jesus Christ, but in the day-to-day implementation of that answer, I recognize is really almost impossible the way things are right now for the average therapist in the average office in the United States of America. It's unethical to take a stand for Christianity, for Islam, or Judaism, but it's not unethical. And in fact, it is prescribed that you do take a stand for Buddhist and Eastern religion. And we just have to start having this conversation. If you have ever gone to therapy, if you're a consumer of mental health therapists, a consumer of the mental health industry in any way, and you have practiced meditation, I'm not telling you to stop necessarily, because if it's helping you get through the day, that's really important. What I am asking you to do is to examine yourself spiritually, though, as well. Is it possible that while certain symptoms have gotten better, have other things started to get worse? Or are you pulled away from Jesus the more you practice meditation? What is happening to you spiritually while you're pursuing meditation to help you manage your anxiety symptoms? Start paying attention. That's really all you can do. And until we start this process and have these very difficult conversations, nothing is going to get better. And I will tell you my strong opinion, which is the answer really is Jesus. At the same time, that is a difficult answer to implement in the mental health industry. But the more we try to pretend that emotional health and spiritual health are not related, or if they are related, it's only overlapping by a small amount, we're not doing clients any good. And we are not helping to reduce the instance of mental health problems in the United States. So if you are watching this and you're struggling in any way and you're wondering, should you go to a therapist? And maybe you're a Christian. I don't want anything that I've said here today to scare you. What I want you to do is to have information and education. I want you to go see a therapist. Now, the tricky part about going to see a Christian therapist or Christian counselor, someone who's licensed, so some licensed mental health professional who promotes themselves as also being a Christian therapist, a Christian counselor, is that all of their mental health training will have come from the secular world. That's just how things are set up right now. You can't get licensed as a mental health professional without going through a secular program. That's how things are set up. So what that means is that they're going to be trained, myself included, in all of the secular approaches, which sometimes means the pagan approaches. Your job going in, and this is a tough job for you to have because you are hurting, you're struggling, and you don't know how any of this works anyway, because that's not your shtick. So you go to a therapist and you want to be able to trust that person. And I am saying you can trust that person. And when they start suggesting modalities to you or techniques or anything to you, it's okay for you to ask questions about that. Gosh, what could be the negative to me doing this? Are there any spiritual consequences that you're aware of? And just ask these questions. Ask the questions and see what the therapist and create a dialogue with your therapist, with your counselor. That's a really important thing to do. Trust them and also be empowered to question, not question their expertise or how much they really care about you feeling better. They really do want you to get better. There's no question about that. I've never met a therapist who just doesn't care ever. They care deeply. They wouldn't have put themselves through all the schooling and the licensure and all of that business if they didn't. I know certainly for myself. And I know a lot of therapists, like we really do care about people. We want you to get better. So you can trust your therapist when you go in, but it's okay to also ask the question, how does this affect my spirituality? Or how does this mindset or this modality or this technique fit with a spiritual tradition that I have? You can ask those questions and it's fine and start that dialogue. And a good therapist will, when you ask that question, and perhaps they've never been asked that question before, would ask themselves, gosh, that's a great issue that you brought up and it's never occurred to me before. And most likely that therapist is going to then pursue an answer to your question just for their own knowledge, because that's, we're trained to do that. And they really do want to make sure that they're doing the best that they can for their clients. And so they're going to start searching out a matter if you bring it up to them. So I encourage you, start that conversation, start that dialogue with them. Now, I'd love to hear your thoughts about all of this. And I know that this is controversial. I know that some of you may have some negative thoughts about what I'm saying, especially if you are not a follower of Jesus Christ. I get that. Uh, I'm willing to engage in all conversation as long as it's polite and respectful, of course. So I'd love to hear your comments down below. If you're interested in this content, I should say, I would love for you to hit subscribe here in YouTube, and you'll get notified whenever something new comes up and I post a new video, or if I have a live broadcast coming up, you'll get all that information. Also, feel free to look for me on Facebook. Just do a search for Be Still with Dr. Anita group. It is a private group so that when we're in there, we can have dialogue and feel a little bit safe to have some tough conversations. And I'd love to see you over there and interact with you there too. Have a blessed day. And I hope that this gives you things to think about.